Patients undergoing chemotherapy are usually encouraged to drink large volumes of fluids owing to the adverse effects of chemotherapy agent and the complaints of voiding difficulty. Most of patients with cancer are ordered with lower urinary tract symptoms before and after chemotherapy. For collecting patient voiding information, a self-assessed voiding diary is a useful tool. This study aimed to describe some different characteristics of voiding according to age and chemotherapy based on information from the voiding diary of a patient with a non-urological cancer who complained of voiding symptoms. This is my disclosure. This study was supported by the grant from the National Cancer Center, Goyang, Korea. The 3-day voiding diary of 96 patients with cancer were analyzed retrospectively to compare the differentiated characteristics of voiding according to chemotherapy and age between 2013 and 2017. All patients were referred to the urologist because of voiding difficulties, and one complete 24-hour voiding diary was analyzed. Patients were grouped according to age and the presence of ongoing chemotherapy. The Wilson-Rankin sum test and the generalized estimation equation were statistically utilized to determine the interpersonal correlation. And the baseline characteristics of the 96 patients were described on the right side of the slide with their information about the voiding diary. This slide shows about the result of voiding diary according to the chemotherapy and age. The comparison of the groups according to age and chemotherapy revealed that the total and the nighttime frequency were significantly affected by age and that voided volume was affected by chemotherapy. However, none of the IPSS items were affected by age or chemotherapy. This slide shows the result about the voiding diary according to the combination of chemotherapy and age. Comparison of the chemotherapy effects within the same age subgroup revealed that the voiding characteristic of the old age group, older than 65-year-old, were not significantly different according to chemotherapy. However, in the young age group, less than 65-year-old, chemotherapy significantly affected voided volume, but not voiding frequency. So after the result we analyzed, we can interpret that the voiding problems in patients with a non-urological cancer was markedly influenced by age and chemotherapy. For those patients undergoing chemotherapy, the young-aged patients were affected much more in voided volume and frequency by the volume of water intake to reduce the adverse effects of chemotherapeutic agent. However, the voiding problem in the old-aged group was not affected in voiding frequency by the chemotherapy itself, but the underlying anatomical problem at the lower urinary tract. So we can conclude that voided volume and voiding frequency were affected by the chemotherapy or age in patients with a non-urological cancer who had voiding difficulty. Large volume intake of fluids during chemotherapy might affect the voiding pattern in patients in young age group, but not in those in the old age group undergoing chemotherapy. Thank you for the attention.